I'm going to record a video where I'm going to coach somebody in regards to how to do a push-up in a manner that is typically prescribed for people who have pain on some of the tissues on the front of their shoulders. And this particular way of doing a push-up is designed to alleviate the stress on the tissue on the front of the shoulder by teaching the person how to get more movement out of their shoulder blade on their rib cage. So here we go. So there's our starting position. Thank you, subject, for your assistance. You can go into a push-up position from your knees, because that seems to be what's more well-suited to your strength at this time. First, let's talk about your spine. You're going to push the crown of your head away from your knees, and your knees away from the crown of your head. And that's going to cause your spine to be long and cause your low back to sag less. It looks really good. Let's talk about the position of your fingers or your hands. Your hands are located underneath your shoulders, and your third finger, thumb, first finger, second finger, is pointing 12 o'clock. When you're going to lower your chest toward the ground, I would like your elbows to go in the direction opposite that finger that's pointing to 12 o'clock. So go ahead and descend at a depth that you feel comfortable with. Down you go, and up you go. Try one more. It looked good. Your elbows were staying tight to your sides, but not excessively tight. Nice. And now we're going to think a little bit about another thing while you do the push-up. You're going to think about your shoulder blades coming together as your chest goes toward the ground. It is not a sequential movement, it's a simultaneous movement. So rather than you're bringing your shoulder blades together and then moving your chest toward the ground, you're going to bring your shoulder blades together and down toward the low back as you move your chest to the ground, which is hard to do. Go ahead and try to do that. Blades come together as your chest reaches the ground or approaches the ground. Nicely done. Try it again. Smoothly done. Blades come together and they come together when your chest is at its lowest point, and when you return to the start position, as you did now, you bring them apart so that you have some distance to bring them together when you return to the chest to the ground. Nicely done. Thank you. And take a break. Absolutely. And thank you, subject. We're going to go another time. Thanks again. Everything I taught you before, you're going to try to remember, which is asking a lot. But in addition, I want you to try to rotate your hands toward your little fingers. They're not going to actually move. You're just going to have that effort. And what that's going to do is it's going to cause these muscles down at the lower part of your shoulder blades to bring your shoulder blades inward toward one another. So all that stuff I taught a moment ago, crown of the head away from the knees or feet, elbows tight to your sides, hands underneath the shoulders, and descend, blades come together, and you're twisting your hands apart, and back to the start. One more. Okay, tearing a towel that's between your hands with your tips of your fingers. And that's great. Give yourself a break. So, what that person is doing is teaching their spine to stay long, teaching their shoulder blades to not go to their ears, but rather go toward the low back area, and teaching their shoulder blades to contribute to a push-up or any movement where the hand approaches the chest. And that's going to be very restful to the tissue on the front of the shoulder. There you go.